Well, just got done with one more soccer practice for the week. It's about my third one this week. But, you know, that's the life of an athletic trainer. So welcome to my video. My name is Chuck Pfeiffer, and today I wanted to summarize for you my interview with my friend and my colleague, Hugh Shapiro. So just thought I'd set some equipment down here. You know, when I had this assignment to try to summarize and talk about a specific topic that was really relevant to our course, the first thing that popped into my head was something that was very, very interesting and very important for our students to learn, and that is, once you get into the field of sports medicine, what can you do with a career? So I thought I'd just summarize a little bit of that, and to use that, I thought I'd use my bag, thought I'd talk to my good friend Hugh, because most people think, well, athletic trainers, well, let's see, those are the guys who do all the taping, right? So, yeah, you're absolutely right. You know, the first thing that you see in the bag, a whole bunch of tape. Different types of tape, pre-wrap, all that good stuff. We got the first aid kit, we got all the supplies that we need, but this isn't everything that we do. Okay? We got so many things, and there's so many places that you can work. And I thought I'd talk to my friend Hugh, so let me give you a little background on Hugh. Hugh has worked all over the country. He has worked in the Northeast, clear up in Boston and New York. He lived in North Dakota, South Dakota. He lived in Nebraska, Kansas, and now he's back up in the Northeast, which is one of the reasons why this isn't a live video, because I talked with Hugh on the phone and we emailed back and forth. I told him about my project. He's also working on his doctorate too, which we'll get to in just a couple of minutes. But I wanted to make you aware of some of the things that athletic trainers do and try to dispel some of the notions that you probably have. First thing I asked Hugh, I said, Hugh, tell me how many different settings you think athletic trainers can work in. And his immediate response was, well, I don't think I could count them all. He said, you got the high school setting, you got the college setting, you can work in hospitals, you can work in sports medicine clinics, you can work in professional sports. And that used to just mean basically football. But now we've got athletic trainers in every professional sport. We've got athletic trainers who are working with NASCAR racers. We've got athletic trainers who are specializing in, even in the military. You know, all those enlisted soldiers are really professionals, and the amount of physical work that they have to do on a daily basis is just tremendous. And so they get injured, they get hurt, they need sports medicine professionals of all ranges. So there's athletic trainers in so many different settings. Hugh and I, we both agreed, I'm not sure we could count the number of different settings, but this is what we're going to talk about. We're going to talk about some of the different settings. I wanted to tell you a little bit about Hugh so that you get an idea of all the different things that even one athletic trainer may endure in his career. So Hugh started out as an athletic training student at the University of Wisconsin, and he did a very typical athletic training career. He graduated with his bachelor's degree, then he went and sat for our national certification exam, which is a board certification exam, very similar to what other professionals in allied health have to participate in and pass. And so he did that, and then he went to work immediately at a high school. And in that role, just like I may see here, we are so busy. You take care of so many different athletes. You've got everything from girls volleyball to boys football and the basketball teams, and in the spring you have all the track people and the golf people and the baseball, softball. And typically, in some schools, there's just one athletic trainer to try to cover all those different things. And then it becomes really tough. So I talked to Hugh and I said, Hugh, what are some of the things that our students need to know about working in the high school setting? Because that may be something that they want to do. He said, it's a lot of work. He said, what you have to do is you have to follow your heart. He said, these kids need you. If they don't have you, they don't have anyone. And so when they get hurt and they find they have these injuries and they got these little nagging things that they just can't quite beat, you're the one who can help them on a daily basis. So he said, you really got to follow your heart. If you're in it for the money or if you're in it for some other reason, he said, you're not going to find yourself fulfilled. So he stayed in the high school setting for a while. He said, I think I want something more. He went to the college setting. And he went to Kansas and he worked on his master's degree at a place called Fort Hays State University, which most of us in the state are probably familiar with. So he went to Fort Hays State and he was a Tiger for a while, and he worked in their athletic department with all sorts of sports. He really had a great experience. The level of competition was, of course, quite a bit more than and quite a bit higher than high schools, and so he saw injuries that were a lot worse, okay, more intense. Also, all the rehab. So he did that. Then he left. He went and worked at a sports medicine clinic in North Dakota, And that included a very different type of clientele, obviously, and a lot different role there. So one of the things that I also wanted to ask Hugh, and I'll sort of interject right here, I said, Hugh, what are some of the different things that athletic trainers do? You know, our students can read in the books, and they can tell, and they can outline some of the things, but you tell me in real life terms, what do athletic trainers do? And he said, they're first responders. Okay? They treat injuries. We try to prevent injuries. Once they occur, we're treating them. We are doing rehabilitation, and we're getting return to play activities with these athletes. So we scan the gamut, he said. You know, once they get hurt, all the way to the time they return. And it may be 2 days, it may be 2 months, it may be a year and a half on some of these major reconstructions of a shoulder or whatever it might be. So at the sports medicine clinic, he got to see a little bit of everything. He worked with some general population, he worked with some athletes. He really enjoyed that, but he still felt a calling to come back to the college ranks, and that's how he ended up here in Dodge City. He was a head athletic trainer at Dodge City Community College, and there we have 14 sports. He covered everything from football to cross country to baseball, basketball, men's and women's. He had everything going on. Very, very busy. But he really, really enjoyed interacting with the student athletes. And after about 3 years, Hugh decided that he really wanted to spend some more time with his family, so he moved back to Boston where his 2 sons are, and they were starting to have families of their own. So he's back in Boston now, working at a hospital, doing rehabilitation, and also working some outreach with some high schools. So Hugh is not atypical. It's very common for athletic trainers to work in many different settings. You know, he hasn't had experience in the professional ranks, but as I mentioned there, we've got professional athletic trainers with football teams in the NFL and the NBA and NASCAR and everything from the Olympics to all sorts of different organizations and many, many different settings. So the focus of our interview during the time, even though the interview was about 45 minutes long, we talked about the different settings and we talked about the different roles. You know, you saw my bag, you see the tape, you see some of that stuff, and you think, wow, athletic trainers just do a lot of taping. Well, that's such a small percentage of what we do. When we're out working games, sometimes even practices where there's no one else there, we become first responders. So we're the only people within maybe miles sometimes and within any quick response time that can really deal with some of these traumatic injuries, and we hope that they never get catastrophic. But in case they do, we're prepared, we're trained, and we practice those skills, and we can take care of the athletes in those situations. Once the injury occurs, maybe athletes have surgery and they need rehabilitation for an extended period of time. We've got training in that. I worked at a sports medicine clinic. Hugh worked at a sports medicine clinic. We've got the skills and the necessary patience and soft skills to help those athletes to return to play. So however long that time period may take, we can help them back. In addition to that, we do a lot of treatment in the athletic training room. We do musculoskeletal evaluations before they happen, which is a very, very time-intensive skill that we learn, and we're very similar to physical therapists and maybe even physician's assistants in that respect. We do lots of evaluations and determining treatment plans. We develop rehabilitation plans. We're all over the place, but on a daily basis, for many athletic trainers, it's a very, very up and down, very wide variety of duties within that day, and that's what makes it really interesting, keeps it really fun. So, when we produce this video and we put it into a class, the first thing that I would tell our students is to dream big. Okay, whatever you want to do within athletic training, it can really be done. If you want to work with young student athletes, that can be done. If you want to work with older student athletes, that can be done also. Some people really like the high school setting. Some really want to stay in college. Some have the dream of being the head athletic trainer for the Kansas City Royals. That can be done too. If you work hard, okay, if you have real expectations, you can get there. So I really appreciated my time with Hugh. We had a great conversation. It was great to go back and talk about all these different things. He has taught athletic training classes, and I've taught athletic training classes. We always spend some time on this topic with our student athletes and the students in our class because we want them to understand all the different options that are available to them within the field of sports medicine. So it's a very important topic, and I'm glad that you were able to take just a few minutes and watch my video. More to come. We'll take this video, expand upon it, break it into parts. We can talk about each setting. We can provide details for the students. We can even provide contacts or more detailed information in each setting. But thanks for joining me tonight, and I hope you have a safe week.